It's your first time to hear about that? Okay, it's okay. You're going to learn about it, and I think after this session you know about it. It's a regulatory body that regulates professions. Means when you are a health professional, like here you are from laboratory and anesthesia, NP, anesthesia, for you to practice, you have to get a license to practice. So in that license, I will explain to you later about.
Are you good? Did you have lunch? Looks like some of you didn't have lunch. No? Oh no. So you're hungry? Yes? No? Yes? Oh no, teacher. The students are hungry. So are you going to listen to us when you're hungry? Huh? Okay, we're going to rush. We're not going to take a lot of your time now that we know that you're hungry. I'm Dr. Leila Mkaruzima. I'm a physiotherapist and I'm the vice chairperson of the Rwanda Allied Health Professions Council. I saw that some of you do not know about it, and the registrar talked about it briefly, and he will continue to talk about it. All I want to say is that it's a regulatory body that was mandated to protect the public and guide the professions. It was mandated by the law, Act number 46, stroke 2012. It protects the public as the main objective and guides the professions. Through ensuring that all professional allied health professions across Rwanda abide by the professional ethics and have the right credentials to practice. So basically that's what we do, and there are a lot of professions that we regulate, including laboratory sciences and NPA and so many, many others. I think he's going to give you all the other details about the main professions that we regulate and all other functions of the council. So keep your questions. You're going to ask questions afterwards, and you're going to also know exactly if you're doing the right thing, if you're in the right professions or not. But I'm very sure you chose the right professions, all right? Okay, thank you so much for listening to us. And again, we are very sorry for being late, for making you late. Have you forgiven us? Thank you. Teachers?
Thank you. Good afternoon, everyone. My name is Simukaigiro Mediatrice. I come from Ruhengeri Level 2 Teaching Hospital, Laboratory Department. I come here to talk to you about biomedical laboratory sciences. Thank you.
Good afternoon. Thank you to be with you. I think some of you have met me in Ruhengeri Level 2 Teaching Hospital. My name is Daniel Savirawagabo. I'm the team leader of anesthesia department in Ruhengeri Level 2 Teaching Hospital. We are going to talk about anesthesia in Rwanda or in Ruhengeri Hospital, how anesthesia is practiced. Thank you.
Thank you, visitors and stakeholders. Maybe let's introduce ourselves. My name is Dr. Celestin Sabdimuremi. I'm the Dean of Health Sciences. You know this man?
Hello. You should know me, no? Oh, my name is Thierry. I'm yours. I'm a lecturer here.
Maybe without further ado, let's give the floor to the stakeholders to take you more.
Thank you very much. Why the still trying to put the projector on, and I think I can start. Try to save time. As I was saying, hello, can you hear me? My name is retired Major Gashere Bukajan Damasen. Professionally, I'm a physiotherapist, specialist, but currently I'm working as the registrar of the Rwanda Allied Health Professions Council. That's my full-time job. The council, in Rwanda we have 4 professional councils, regulatory bodies. We have the Rwanda Medical and Dental Council, the nurses and midwives, the pharmacy, National Pharmacy Council, and the rest of the professions are regulated by Rwanda Allied Health Professions Council. I will tell you the different professions we regulate. Councils are established by the law. And the Rwanda Allied Health Professions Council has been established by, it's okay. Let me continue trying to read. They said projection it's not possible, but I think you will try to follow, isn't it? Yes, so the council, Rwanda Allied Health Professions Council, was established in 2013 by the law 46/2012. And the law, and it's made of specialized various health professions. And what that way you find all those professions. They offer different services to patients, working with other health providers in taking appropriate decisions regarding patients' management for the provision of a good quality care. That's why we came here today with somebody, specialist in laboratory and the one in anesthesia, because these are the professions where you are undergoing now, isn't it? Some are in the laboratory, biomedical laboratory, others are doing anesthesia. So these are professionals who have qualified many years ago, who are now practicing. So we found that it would be good for them also to come and tell you about the profession. Sometimes when you are in the first year, sometimes you didn't even choose that profession, and you found yourself there, isn't it? Who is that person who found himself or herself there in the profession they didn't choose? All of you chose, you are in the profession that you chose. Sure, that's good. So they will tell you about your profession, the profession you are studying now, and the one we are going to practice later. So I was saying, the council, we have our role normally is to protect the public and to guide professions. It means you promote the profession, but also protect the public. It means we need to make sure that people who are going to practice those professions, they are very good. They have all the competencies needed. That's why when you complete your cycle in 4th year, you have to sit for exam. Exam by Ines, but you also a licensing exam to get a license to practice. Okay? So now, we need to make sure that the person who is allowed to go to touch patient, to go to work in laboratory, to go to to work in anesthesia department is that person is really has the skills and the competencies needed to make sure that the patient they don't get harmed. So that's why the role of the council is to protect the public and promote the profession, which means somebody who does not have a license will not be allowed to practice in Rwanda. What are the professions we are regulating? Just for your information, we have there are around 22. I don't know if you've heard about this. There's a biomedical laboratory, anesthesia practitioners, biomedical laboratory, clinical psychology, you've heard about that, dental therapists, environmental health officers, medical imaging, that's in radiography, nutritionist, occupational therapist, clinical officers, emergency care practitioners, social workers, ophthalmic clinic officers, optometrists, opticians, orthopedic clinic officers, physiotherapists, prosthetics and orthotists, public health officers, biomedical engineers and technicians, chiropractors, speech therapists, and clinical perfusionists. Then there are also others like cardiovascular technologists, nuclear physicists, they will say nuclear medicine. All those professionals are regulated by this council. So how do we go about it? We work with students. Each one of you is asked to get an indexing number. Have you already got your index number? Yes. So the index number, it shows that you are in that profession. And the council, its role is to follow your performance from first year to the fourth year to make sure that at the end of the fourth year, you will be ready for the profession to sit for the exam so that can get the license to practice. So there are many professions that we regulate. So why do we regulate? Here we're talking about the student indexing, you know about it. But for those who are qualified from outside, they will need to get equivalence from the Higher Education Council. Now, every student who is undergoing a professional, health science, allied health sciences, must get index number. I explained to you the reason why you need to have it. Why do we need this? When you register, you get a certificate of registration as a professional. That's to ascertain that this person completed all the requirements for them to become professionals. But the certificate, you get it once. When you register at the council, you get a certificate of registration. If it's at the bachelor level, you go to the register of bachelor. If it is master's or specialist, you go to the register of master's or PhD specialist. So that shows that you are a professional. But that not gives you the authorization to work. It's only the license to practice that you get. After registration, you get a license to practice. When you pass your exam, you get a license to practice, which is has a validity of 2 years. Why 2 years? Because you need to continue developing your skills. That's why after 2 years, you will come back to get a right to renew a license, and then you have to prove that you've been undergoing some courses to improve your skills, ethical skills and other in your profession. So it gives you a professional pride, because when you know that you are qualified and you got your license, yeah, you feel good about that. But it means that the care you are going to give your patient, it will be of quality, and the patient trusts you. There is a trust between you and the patient, because they know that the person who is working, we are 100% that is allowed to practice. is allowed to touch me or is allowed to do anesthesia on me, because the patient will have to see, I mean, to trust you before you treat them. So it gives you the assurance of skills and knowledge that you needed, but it also gives you job opportunities, because when you want to go to work somewhere, private or in a public, they always ask you to prove that you have a license to practice. And then, so it opens job opportunities for those who have license to practice. So the license, how does it work now? The process of licensure is a process by which the authority that's put in place by the government, as I told you that it's established by the law since 2013, now it is 30 years now, and it gives you that power to regulate the professions. So you have a minimum legal requirement for healthcare organization and practitioner to operate or care for patients. So it restricts entry to practice to unqualified personnel. So how do we get it? As I said, when you complete your degree, you get a degree, but you have to sit for licensing exam. And once you pass your exam, then you get a license to practice. And it's only the license to practice that allows you to practice. And it is renewed every 2 years. So far, are you with me? Yes. So your aim is to work hard so that when you get in the 4th year, you sit for exam, then you pass. And believe me, this time, these days, usually the council organize exams 3 times a year. But once a year, it is organized at school. It means when those who are in the 4th year, if you have people in the 4th year, they will sit for the exam here at school. To the point that when you graduate, you also have your license. You don't need to wait for time. But if you don't sit for your exam here while you are still at school, we have 2 other sessions throughout the year that you can come and sit, depending on when you want to sit, because it's up to you to get a license or not. Because you may complete your anesthesia and then you decide to go to become a taximan. Yes, why not? You don't know what's going to come tomorrow. Maybe next year, taximan will earn more money than people who are doing anesthesia. So then you may decide that, which I don't think that you will do. But I'm explaining, what I want to tell you is that when you are not practicing the profession, you don't need to get a license. Okay? So you only get a license to practice. When you are not practicing, you don't need a license. So you can qualify here and decide, no, I'm not going to practice. I'm going to do agriculture or whatever. You know? Or you are appointed to become a mayor somewhere there. So then when you are a mayor, you are not going to practice the profession. But after when you are outside of your profession for 2 years, after 2 years, for a period of 2 years, after those 2 years, when you come back, you have to work under supervision for 3 months to make sure that you really remember what you still have the skills required to treat patients. Are we together? Good. Now, that's the process of you are doing your training now, but you need to know that there is a regulation. And the regulation starts even in the 1st year by doing your indexing. You need to get a license and indexing number. And the indexing number, it's not only for the council, even for the planning at the Ministry of Affairs. So you know the 4x4 program, I think you came here because 4x4, that's why we have many students now. We have targets. So we need to make sure that people are indexed, what are the number, and then we can plan for 3 or 4 years or 10 years ahead. So that's why we need to know the people or the students must be indexed so that we know the number and then we have projection in the future, for the future. So now, but the council works with professional associations. This is another issue. Professional associations, they look at the interest of professionals. Let's say, like you can have an association of students, which will be, looking at your interest, or you go to claim when there is a problem. Don't you have associations here? Yes, yeah, those are the associations. So professionals also can have associations. But those associations look at their interest, not at, they don't protect, they can look at the salaries and things like that. And then wherever you want to claim, then you go through the association. But the council also works with the association. Why? Because it's through the association that they have all those professionals that they are going to organize those continuing professional development sessions for their professions. So that's why we work together with professional associations. Okay? Many of these things are still new in your ears because you are still new. So now, so it's very important then when we regulate to use the standard guidelines. We have standard guidelines for anesthesia, which are international, standard guidelines for laboratory, which means the laboratory you are learning here is the same that is taught in America. It's not, there is no laboratory for Rwanda. We have standard guidelines that need to be respected. And when they develop curriculums, they also look at those standards, minimum standards, so that need to be respected, that are required for every student to go through and to complete their cycles, their degree. Okay? So now, councils use those minimum standards to regulate the profession. Because we work with schools like Ines, when they want to start a program. And that program, together, is assessed with the Higher Education Council to be approved. To say, okay, yes, we see this program. It can be validated and can be taught at the Ines because it respects the standard guidelines. It means that we see that after 4 years, this student who will be undergoing this program, we have the skills required and the competencies required to become laboratory scientists or to become anesthesia, non-physician anesthetist. So those are what we call standard guidelines. So the council uses standard guidelines for all these professions. That's why we regulate more than 20 professions. I told you that professional, I'm a physiotherapist, but we, as the registrar, we use standard guidelines of every profession to regulate the profession. Okay? So why? Because standard guidelines are a set of practices or ethical considerations and behaviors that members of a particular professional group must adhere to. This set of standards are frequently agreed by a government body, so they are approved. When we approve the standard guidelines, we call the associations, we call the professionals, we call the Ministry of Affairs and the Higher Education Council, and you agree on, say, okay, for laboratory, these are standards, and this standard must be international. You will see later what I'm saying here. So, when we look at why is it important to observe professional standards? It's very important to observe because they guarantee that we are accountable for our clinical decisions and actions. That comes now professionalism. So whatever you do, you need to be accountable. That's why the council works with students, indexing, professionals by issuing licenses, but also we do a follow-up whenever there is an incident, we conduct investigations. Because everyone is accountable to make sure that if you have this incident, what is the responsibility of the professional or the environment they are working in? So that gives you an idea. So that's why council can also sanction people. For example, if we find that it's due to negligence or whatever, or incompetencies, it means that there are sanctions that can be taken by the council against professionals who are not respecting the standards that have been put in place. Professionalism is very important. You need to understand from now that whatever you will be doing, you will be accountable for that. Okay? So now, and professionalism is very, very important because the behavior that demonstrates, first of all, good character, and is marked by pride and self and career in your career. Once you are a very good, when you become a very good professional, it means you become a professional, your level of professionalism is high. And you will be somebody who will be, you will get more let's say if they are looking for somebody with whatever, there's a job, somewhere, job opportunity somewhere, they look at your CV, they look at your professionalism. So professionalism is very important to open doors for you. Now, why do we need to, why I was saying that standard guidelines they need to be international. You know now, Rwanda is part of the East African community. Do you know what is the East African community? Do you know? How many countries do you have in the East African community? 7, 8, 5. Okay, now I'm going to ask you. How many?
8.
8. Okay, give me 2. Just 2. You said 8. Give me 2.
Rwanda.
Rwanda. And another one. Who can give me the all countries? Who can give me the 8 countries? If it's 8 or 6. Eh? 7. Let me go at the back. I mean, usually people when they sit at the back, they don't want to be asked questions. Because they are doing their own things. What is the question I've asked?
Uganda. South Sudan.
Burundi. Yes.
Somalia.
Okay, you can clap your hands for yourself. So now, why am I saying this? I said the standard that must be international. So now, Rwanda entered the East African community in 20 what? Maybe you were not born. 2010. In 2010, Rwanda entered the East African community. And there is what we call East African Community Common Market. Common market means we are in a process of harmonizing our professions, our way of training, and our ways of practices in the East African community, so that when you have your degree from Ines, we will be able to go to work in Kenya. We will be able to go to work in Burundi. Who want to go to work in Burundi? Who want to go to work in Kenya? Kenya is dollars. No, it's Kenyan, but Kenyan shillings is very expensive. So please listen. The harmonization process we've already started. It's going to allow you, young people, to get open markets so they can be able to work. Don't just look at the market of Rwanda. Say, oh, we have a lot of people trained in a laboratory or anesthesia, so then I'm not going to get jobs. No, now the process has already started that we are going to harmonize. We are in the process of harmonizing our training and our practice in the EAC. So that once we have what we call a mutual recognition agreement between all ours, it means the people from laboratory, from Rwanda, from Kenya, from Uganda, we always meet. And once we are going to complete that process, it means we are going to reach what we call a mutual recognition agreement that will allow the free movement of labor. You understand? I think this is also information that you need to know. Don't just look at Rwanda only. No. Look at the larger East African community that will be able to work maybe in Kinshasa or in Ituri. Who want to go to work in Ituri? What is in Ituri now? Eh? What is in Ituri now? What is the current news of Ituri? You are not aware of what is happening in Ituri. Ebola. There is Ebola in Ituri now. So if you want to go to work, they need people who are trained in the laboratory, and you can go there and you get dollars. You don't want to go there? Okay. So that's what I was telling you, that the council uses international standard so that we can prepare our students for the common market we have in EAC. So now it is already started in some professions, like I think it's an ongoing process. It takes time because now in Rwanda we only have medical council. They've reached very advanced steps, but others also have already started. Like other professions have already started. Yes, I'm going to tell them the profession that already started, the process. And this process will allow the freedom of movement, regulation, and harmonization, as I was saying. And it will allow professionals to move freely between all our countries. So far, we have professions like give you biomedical laboratory has already started, clinical officers, physiotherapists, environmental health and public health, nutritionists, dietitians, medical imaging, occupational therapists, then ophthalmic clinical officers. They've already started. So they're already in the process. So which means that once we codify, maybe in the next 4 years, don't just limit yourself to Rwanda, because I'm sure that time we will have a mutual recognition agreement between all our member states. So that's very important. That's why when we regulate, we don't just look at what is happening in Rwanda. You know, we need to make sure that when they train you, the skills that you have at the end, we open doors for you in the East African community, but also in elsewhere. Because nowadays we get people who go to work in the UK, and, you know. So don't just look at think that Rwanda is small, that we are not going to get jobs. So the country is trying to open and to enlarge our territories. Yeah, so let me stop here by now and allow our two professionals now. Here I came with somebody who is currently practicing laboratory and somebody who is currently practicing anesthesia. So they are going to tell you about those professions. Don't you need to know better about your profession you are studying? And not only that, but also to show you the career progression. When you qualify, what else you can do from laboratory? Is there anything, other things you can do? What levels you can, the other levels you can reach? But before they come in, there is also what we call grading. When you spend many years in your profession, you get graded. You can be from when you start, you are a junior, but you can also a senior. When you are at the level of specialist, you can become a consultant or senior consultant, things like that. But it comes with time. There are some criteria that you need to fulfill. It can be research. It can be the year of experiences. There are the things that need to be fulfilled. So now, professionals who qualified, they can also apply for grading to get that grade, so that when you qualify, you are a junior. But when you go there in the service, you find people who have been working for 20 years. So they should be recognized for those experiences. Those as a grading. And every professional wants to get a grade, to be evaluated so that they can get their grading. It's done by the council as well. But it's done individually. It's up to you to ask for it. And when you ask it, we look at the credentials, and you can give you the grade depending on what the Minister of Labor has already established. And when it is like that, it can go with some advantages. It can be salary. it can be some other advantages that can go with the grading, the different grading. Thank you very much. In summary, what I said that the council regulate the profession from the training to the practice by following the way you are trained. You know, we for example, we organize regular inspection together with a higher education council to make sure that the curriculum is being implemented properly. Then at the end, you will sit for a licensing exam. You get a registration certificate once, and then you get a license that is renewed every year, every 2 years, according to the law. And with the renewal, you will need to have credit. Those credits are the courses that you've been doing, then 60 credits. That means you need to have 60 hours of continuing professional development. So that's how we intervene. Then we work with other countries, as I was saying, in the process for harmonization, but also we make sure that people are doing the right thing. Professionalism is very important. Ethics is very important. That's why when there is an incident, when there is a problem that happens to a patient, the patient can claim, or the institution can also claim, and that's the council, to investigate, to see if there is maybe a professional that is behaving unprofessionally, and then for that, if you find that there is an unprofessionalism, we can also give them sanctions when it is needed. But our role is not just to sanction, it's to educate, to make sure that what we do is for the public, is to protect the public. The service we are offering is a service of quality. So now let me give time to our two professionals here to tell you about the profession. Let's start with Mama Mediatrice. Thank you very much. You know that laboratory is very important even for medical doctors to take decisions, you know? And also there are a lot of opportunities because you can have specialization in different domains. Like here you have there are masters, you have your specialty in hematology, in microbiology. There are many areas of specialization. So don't think that you are going to be limited only by you get the bachelor, you are that's the end. No, there is opportunity. You can continue and get into research and get PhD. But there's a lot of opportunities for laboratory practitioners. As she was saying, you know, for a doctor to take a decision, they will always wait for the results from the laboratory. So it means they are very important. It means your role, it's key. If you give a wrong information, as I was saying, and then it can affect the patient, or it can give you, if you give wrong, she was talking about Ebola. Imagine if somebody take a sample at Gisenyi and said, oh, somebody has Ebola. And we know that's going to affect the whole country. Or you get it and you keep quiet. Or you miss it. When you miss it, it's going to affect many people. So it's very important your role as people who are doing laboratory. You need to really to learn and understand what you are doing. Understand that your role is very important in the health sector system where decisions are taken. Sometimes you meet with the patient when you are collecting samples, but you are not the one who give the answer to the patient. They will send it to the doctor, and the doctor will use your what you did to take decisions that can help for the cure or to prescribe medication for that patient. So it's very, very important. The profession you are doing is also very, very important. Now, let's hear also about the anesthesia.
Thank you. As I said by the introduction, my name is Savira Bagabo Daniel. I'm a team leader of Department of Anesthesia in Ruhengeri Level 2 Teaching Hospital. My experience in health sector starts in 1998, when I was a nurse. In 2001, I started my study of anesthesia in former Kigali Health Institute. I think you don't know the institution. It's one of the branch of UR now, before the reform. I finished in 2004. I started my career of anesthesia in Kibuye Hospital. Then I came here in Ruhengeri Level 2 teaching. So my experience in anesthesia is 21 years. Since 2006, I worked in Ruhengeri Hospital as an anesthetist. I worked in many fields. I did many trainings. I held many responsibilities. I did mentorship in different hospitals. I did the training with the other partners. I did some missions with partners in Rwanda, in different countries, even out of the country. That is my experience. We can say about anesthesia. Some of you have some perception of anesthesia. I don't know what perception you have in anesthesia. If someone can stand and tell us about anesthesia, what he feels like or he understands about anesthesia, especially one who are going to study anesthesia. One of you? Those who are going to study anesthesia, can you stand and tell us what? Yes. You can stand and talk about what you understand by anesthesia. Who is a volunteer? No one. But even you are not a candidate for anesthesia study, but you are candidate to be given anesthesia. So what is your perception by anesthesia? It's your first time to understand anesthesia. Really? Is it true? Anyone who knows about anesthesia, even small things? You hide yourselves. So let me help you. Let me help you. Let me help you. So let us go fast. Anesthesia is a procedure or a technique applied to a patient who is going to get surgery. It is drugs. It means the patient gets drugs which make. Oh, I started already the explanation of anesthesia. But he can give you his idea. What do you understand by anesthesia?
Thank you. Anesthesia, it's a good professional. It's a good professional because it helps the doctors like surgeon to prevent it keep the patient suffering the pain during the surgery. I think so. And anesthesia professional like anesthetist, it play vital role in the surgery, like the monitoring the vital sign of the patient, prevent the patient from suffering, and another thing. In the short, anesthesia play the vital role for the performing surgery operation in short, I think.
Thank you. Thank you. As I said, anesthesia, it's a drug given to the patient so that he cannot feel pain, he cannot get sensation of pain or harmful to the procedure which is being done on his body.
May come to it in our licensing exam ugasanga tutabyiteguye. Urabyumva? So you need to, your responsibility ni ukugira ngo namwe mwige ariko mugomba kumenyeka ngo ishuri naryo rirakurikiza inshingano zayo. You understand? Urumva? So council rero ifatanya muri icyo kintu cyo kugira ngo let us make sure that the school is providing what is needed for these students to get the skills and the competencies they need at the end of the course. Koko, if it is not the case, if you are not covering all the courses, twebwe tugiye gutegura ikizamini, of course dukora n'amashuri yose, ariko tureba curriculum yemezwe na HEC. Numva rero hari ibirimo ariko mutize bizabagonga. Ugasanga hari abatsindwa. Urumva? Ariko iyo utsinzwe ufite chance yo kongera kugaruka, ariko nabo twifuriza gutsindwa kuko abakozi barakenewe. Sibyo? Urumva atari ngoma ko mvuga no mu Kanyarwanda si mu Kinyarwanda. Iyo tuba mu Kinyarwanda nyine mutuma byumva neza cyane nanjye nkavuga neza uko nshaka. Hari East African Community tubamo. Iyo tuyirimo rero bidufungurira market. Niyo mpamvu turimo kuranga ngo program hariya izajya yigwa muri Kenya bari ikorerwa hano no mu Burundi n'ahandi hose kugira ngo umuntu wese urangije hari n'ufite license yo mu Rwanda ugiye muri Kenya uyikoresha. Niba uyifite ujye muri Uganda, niba muri Uganda ashaka azakora hanga. Ibyo nibyo bita free movement of labor in the ESC. Sibyo? Icyo nacyababwiye nacyo. Aho kindi nabwiye nuko when you have a license means at the end it is valid for 2 years. Ikaba renewed kubera ko wagiye ukora continuing professional courses atuma ushobora kugira gute. Ushobora gukoma ufite skills zikenewe. Kuko izo zizagufungurira opportunities aho uzajya gukora. Bara uzajya gukora bakagukurikiza mina wasanga you are better than others. Numva rero tugomba kuhora twihugura all the time. That's what is icyo nababwiraga. Iki nababwiye cya nyuma nuko when there is a problem we go there to investigate. Sanga ari kibazo watewe maybe na overloading so akubura ahantu ko rurume ko yavugaga kuri. Hanyuma none wakaruha ku buryo wedakora amakosa. Niba ari umwe amazora ngaha akora icyo gihe ntabwo uvuga ngo ni ikosa rye ryabiteye so kuba yarushye. Niyo mpamvu aho investigation to make sure what is the role of the environment akoreramo eso mukozi nkuko umuntu ashobora kuzuka murangarana yamurangarana agiye kumutera umuti akamutera umuti utariho bibaho ya utariho rero ngo hashobora kubaho izindi ngaruka ababwira laboratoire mu Kinyarwanda nayo muyumve neza kandi abarabo nibo benshi hano. You need to understand umaze imyaka igana gutya akora muri laboratoire ntabwo ari abantu bavuga cyane bo barakora. Urumva rero kare babwire muri make y'Abanyarwanda igira imbere gato yamumve n'abari abinyuma
abicanye na bagenzi bacu murabasobanura
shira bakakanga
bicanye na bagenzi bacu murabasobanurira ku kijyanye na labo. Twavuze akamaro ka labo muri sosiyete ariko tuvuga n'akamaro ka labo ku muntu uyikora kuri sosiyete nababwiye ko icy'akamaro ka rabo ni uko rabo igaragaza uburwayi hakibona. Twavuze urugero rwa Ebola. Kuvuga ngo Ebola niba iri muri Congo bayimenye kubera ko rabo yayipimye. Ubu mu Rwanda bari gukora investigation. Wenda mujya mu byumba mukavuga muti ambulance izanye umuntu bari kumukekaho Ebola. Baba bari kumukeka nyine ko afite ibimenyetso bisa nayo, kuko Ebola isa n'izindi ndwara. Kuriya gukeka gukurwaho na rabo. Ngo rabo nivuga iti uwo muntu ni malaria mumureke yikomereze, uwo muntu ni ibicurane mumureke yikomereze. Ako ni akamaro ka rabo muri sosiyete. Akandi kamaro ka rabo muri sosiyete, abarwayi bashobora gukenera amaraso. Ariya amaraso ntabwo wapfa kuyaha umuntu utayapima. Ugomba guhuza amaraso ufite mu bubiko yatanzwe n'umuntu utazi ukayahuza n'ugiye kuyaha. Ibyo byose ni rabo. Nuko noneho ikindi twongere tugaruke noneho akamaro ka rabo kuri nyirako, ku muntu ugakora. Nababwiye opportunité ziriho. Nababwiye ibitaro, mbabwira amashuri, mbabwira ama ONG, mbabwira n'ibindi byinshi. Hariya hose iyo uhakora baraguhemba. Icyo bavuze cyo kuri anesthesi, arayadi service kubera ko hari yaje nyuma ntabwo yari yabona abantu benshi. Ubango mu Rwanda rabo ikenewe kuva ku rwego rwa poste de santé. Ariko poste de santé ntabwo yabona umuntu ujya gukorayo n'ibitaro bitarababona. Natwe ubwacu n'ibitaro biri mu mujyi twemerera abakozi 24. Ubu turi abakozi 17 n'umuyobozi wa 18. Abandi baracyabura. Kandi na ministeri iravuga iti biriya bitaro bifite 17. Niba hari n'umuntu urangije ntabwo turi abafite 17, hari abandi badafite n'umwe. Bakavuga bati bari abafite 17 nibe baragerageza dushakishe bari abafite umwe cyangwa nta n'umwe bazamure. Ku kijyanye rero no kubona amafaranga, mwebwe muri bato icyo amafaranga impamvu nakivuze cyane ngiye nuko wenda ntafite imbaraga zo gukora ahantu 2 cyangwa 3. Ariko abantu dukorana b'abajene bakorera amafaranga kandi bo ntago basha kure. Kuvuga ngo yirwa mu bitaro akarara kuri porominibisi, undi munsi akirwa kuri porominibisi akarara mu bitaro. Aya bari amafaranga. Upfa kuba uri umujene gusa wowe ufite imbaraga, nta kindi. Noneho ku kindi cy'amafaranga, uvuga ngo mwebwe mwige neza. Niba uri umunyeshuri wize neza, Dr. yagize avuga ikintu cyo kwispecialize. Hano hari specialite ya microbiology, hari ya hematology. Ufashe igihe niba urangije bachelors ukaza kwispecialize, ukaba umunyeshuri mwiza w'umuhanga ufite discipline. Nurangiza ushaka kuzakora mu bitaro ukaza no kwigisha hano. Abo bose bazaguhemba yo n'amafaranga. Bakamuha imiti itariyo, akicwa n'indi ndwara utabonye. Muri bya bindi bahoze batubwira umurwayi azarega. Kanso nizaza ishaka kukurengera azasanga amakosa ari ayawe. Iyo atari ayawe kanso irakurengera, ariko ayo wowe wikoreye ku giti cyawe. Niba umuntu avuze ati nta malaria arwaye akicwa nayo, kanso nta hantu izahera. Ku kindi cyo muri rabo wenda twakwibukiranyaho ni uko kubera ko rabo nyine ifite ijisho rinini ku murwayi. Muri dufite inzego nyinshi zikontorora ibisubizo dutanga. Ni ukuvuga ngo hari urwego, hari rabo nkuru y'igihugu iza mu bitaro byose igafata sampo nke kuri sampo twapimye ikazijyana. Rero byaba bigayitse uri umunyeshuri wavuye muri Ines warize neza bakavuga ati ari ahantu kwavuze ngo harimo malaria, rabo nkuru ikaba yayibuze bimeze bite? Icyo umuntu wapimye aba yariyanditse, ni wewe bitarukaho. Cyangwa akaba turiya muntu ko ararwaye igituntu mukavuga ngo ntacyo uyu muntu ari, bagutegeka kujya kumushaka. Wagera ugasanga umuntu yarapfuye kubera ko atavuwe. Ibyo byose buriya biri kwica kariya yawe. Ikindi ku kijyanye n'akazi, murabizi ko mukora ama stage mu bitaro. Ahantu wakoze stage ubundi nabo bakurangira akazi bitewe nuko witwaye. Wango nuko kiriniki tubajije iti nta muentani mufite aho ngaho, dushobora no kuba tumufite tukavuga ngo ntawe, kubera ko twumva nta muntu twamurangira. Iyo warangiye umukozi umuntu ni wamubaza buri gihe. Rero mu gihe cy'amastage ndabo mugerageze mugendere kuri regulation z'ibitaro kuko uriya mwuga muba murimo stage bahita kwimenyereza umwuga. Nuhagera tukakubwira duti iyi weekend uzadufasha, ntuzavuga ngo muri nesi ntabwo twiga muri weekend kuko muri nesi uzaba waravuyeyo, uzaba waraje kwimenyereza umwuga kandi wa mwuga uzawukora muri weekend ukore na nijoro. Rero kare yanyu muyubake neza, mwige neza, mukore pratique neza, ubundi abafite imbaraga amafaranga arahari. Mupfa mwe kwitwara neza gusa control itazabagaho kuko uretse izo control dukorerwa na labo nkuru hari n'izindi sample ziva hanze zikaza zo zifite ibisubizo zikava nko muri Canada zo zibara labo yose. Ubwo labo zifayirinze bashobora no kubwira minisante batirira labo buyifunze, wenda harimo abatekinisi 10 uri kumva nawe washyira mu kinyamakuru bati labo runaka bayifunze kubera ko yafayirinze, uri kumva nawe nyine aho mwaje muranyura. Ubwo rero ni karibu bacu bato mwige neza ubundi muze duserive abanyarwanda.
Murakoze cyane. Ubona mutari mukeneye ko nababwira no mu Kinyarwanda se. So nduba tugiye gusoza. Ariko ntabwo tuzoza tubavanywa yo kubaza ikibazo. Niba hari abafite ibibazo bashyire hejuru baba none tugende dusubisubiza. Ikibazo kimwe hano, 2, 3, 4, reka tere hano gaho baza haguruka uvuge cyane ko ntabwo bindi birimo gukora.
Murakoze.
Mureke twumve ibibazo.
Mazina yanjye nitwa Uhiriwe Ezra Fabrice. Ikibazo mfite mwatubwiye ko iyo umuntu arangije kwiga bachelors agomba gushaka nyine nuza
license.
Ikibazo ni kwibaza ese niyo ukomeje ugakomeza muri masters nabwo iyo urangije bigusaba gukenera license ijyanye n'ibyo wakomeje kwiga. Icyo ngicyo murakoze.
Okay, rakoze. Iyo urangije bachelor ukora licensing exam, iyo urangije license ushobora gukora interview. So donc peer review, donc abandi bakoze masters bakaba bakubaza muri makeya kugira ngo barebe ko ibyo bintu uko wabyize. Ariko so far turabitangira. Ariko biri mu zubundi umwe murangije masters ahita ahabwa license atarakora ikizamini. Ariko siko ahandi haraho bakora exam. Ariko twe turabitangira. Kuko turatangira kanso ntaho twahise tukoresha ibizamini byatangira hashize imyaka 3. So umva rero ni ibintu bigenda biza dukurikije uko bigenda bize. Nk'ubu hari ibihugu biri advanced n'aba professionals nyuma y'imyaka 5 barongera bakora exam. Professionals barangije. After 5 years they also have exam. Kugira ngo barebe ko bakiri. Niyo mpamvu continue professional development ari ngombwa. Urumva kugira ngo muri skilled. Ubundi barabaza ikibazo hano inyuma. Nihe? Yego. Vuga cyane. Bumve.
Murakoze. Natubwiye kubijyanye na indexing number.
Indexing number.
Bamwe muri twebwe ndakeka na indexing numbers bafite, ariko ubwo nashaka kubabaza ngo ese nize criteria ni ibiki bikenewe kugira ngo ube ufite iyo indexing number.
Sawa.
Ikindi cya kabiri nashaka kubabaza mwatubwiye kubijyanye na salary. Bijyanye na salary mwatubwiye ko nyine amafaranga ahari mukavuga en general, ariko uko byagenda kose government ibifite uburyo yasetinze ibintu biri standard, umuntu agomba guhakurikira muri aya ngaya ntabwo ashobora kureba.
Reka twumvikane. Mureke twumva ari. Igiciro. Igisubizo nawe giye nagisubiza kuko ntabwo sindi umulaborante cyangwa inuzi. Ariko uko wabivuze leta ishyizeho structure. Leta hari leta hari na private. Urumva? Leta ishyizeho structure, ishyiraho structure avuga ngo abantu bangana gutya bizi ibingibi bahembwa yangaya. Aho ntacyo wabihinduraho. Sibyo? Ntacyo wabihinduraho. Ariko navuze ngo iyo uri muri skill dukenewe ahantu ushobora kwempoza tugiye ntabwo ndi bukora ayo nganda akorera. Kandi ntabwo umuntu akora mu Rwanda gusa. Ushobora gukora n'ahandi, ushobora muri privé uko babakeneye. Kuko bagukeneye ayo mafaranga wababwira ayo ushaka. ariko igihugu kiba gifite amafaranga gukurikiza ubushobozi bwacyo ngo ntabwo umuntu hano mu Rwanda ahebwa nko muri Kenya. Uwo muri Kenya ashobora kuba akubye inshuro enye kuko igihugu kirakize cyane kurusha u Rwanda. So urumva rero nubwo twigangana ibyo hari umushahara leta ishyiraho, aho ntacyo twawuhinduraho rwose, kandi nta kintu bisaba ni admission letter y'ishuri ryawe, then you apply it online, ugashyiramo diplome yawe ya secondaire nibyo bagusaba, nujya kuri website ya council biriho byose. You do it online, after 3 days urayibona iyo wabishyizemo byose. Abatarakora indexing musabye gukora indexing kubera ko niyo mutarabikora muri mu makosa, ubundi Ines bajyaga babikora hakiri kare. Ugomba kuri muri bakeya hari, ariko nta kintu kigoye, ni ugushyiramo ibyo biri online byose. Ntabwo ukeneye kujya kuri council, ubikorera hano kandi ukayiba. Abazibonye ni bande? Ntababonye indexing certificate ntabo, ahubwo ubwo ni ukureba rero ubuyobozi. Feb and March niho kuba afite indexing kabisa, ndumva harimo witness rwose sinzi igituma, kuko limited agomba gushaka indexing. Ndumva rero ntabwo ari ibintu bigoye, nimujya kuri website no guhera umunsi, ariko wishyura 5,000, wishyura 5,000 kugira ngo ubone certificate. Kubera iki? Kuko ntabwo uzakora license exam utarabaye indexed. Icyo kimenye, ugomba kugira indexing number kuva mu wa mbere, niyo ukurikirana, ntabwo wongera kuyishyura. Wishyura mu wa mbere kaba birarangiye, ariko bidufasha gukurikirana abantu na Ministry of Affairs, ko tuhita dutanga report muri Ministry of Affairs. Nk'ubu ntabwo bazi umubare urahanga kubera ko nta index, nta batubajije abari indexed, ntabwo twari tuzi ko batari indexed aba hano. So urumva rero February cyangwa March ni kabisa, numva na amezi abiri yashize, ntabwo rero mwari mukwiye gutegereza, biroroshye mu bikore online, you don't need to go there. Yeah, undi wari wabajije ikibazo iyo, tufate ibindi bibazo nka 3 wenda kuko amasaha arimo kugenda, sibyo? Yarenze amasaha, yarenze, nidufate ibindi. Gaho ikibi cya nyuma sawa.
Ngiye ikibazo nari mfite mbere yuko nzanga nabanje kwiga prive hano, ariko nigaga rabo nyine nari mazemo amezi 2 narapayize n'experience.
Warayibonye? Ushaka kuyihindura, iyo ugomba kuyihindura uzandika bayiguhindurire.
Uzandikira abandi?
Hariho email wandikira ugashyiramo iyo index number bakaguhindura baguhiya hano. Iki ni ikibazo personnel. So nta wundi ufite ikibazo rero, dufate yuko nta wundi, cyangwa murabiretse amasaha yagiye. Okay, muri make ariko reka mbashimire kubera kwihangana. Urumva mwihanganye, tuba twaje kugira ngo tubahe ayo makuru kandi ndumva muba muyakeneye, sibyo? So ahasigaye one question. Okay.
Murakoze.
Reka twumve ikibazo cyewe na murakira bareba mwese.
Murakoze, hari ikibazo nahoze nibaza. Uko turi hano turi parite ebyiri, hari aba
laboratoire, abari sponsor n'abatari sponsor.
Yeah.
Bimenya. Bimenya. Wari mu bimenya.
Nyo ndi sponsor. Nako
urimenya.
Ikibazo nari mfite muri amakuru make banda bagenzi bacu baduhaye nyuma ya graduation, basinye yuko misi 15 bazata babona akazi, wenda bajya mu kazi. Ubwo abari self support abi sponsoring, ubwo bo bigenda gute nyuma ya graduation? Basaba ko kora inuza ikizami cy'akazi cyangwa nabo?
Oya, ntabwo ariko bimeze hano. Abantu bose bafatwa kimwe mu Rwanda, waba uri self sponsored cyangwa abandi. Nuvuga mwese niba murangije liste y'abantu barangije bafite license, urumva byose Ministry of Affairs bibifite. Icyo gihe rero itanga akazi kurikije uko imyanya ihari, ariko nanone ikurikije nuko abantu bagiye babona amanota. Icyo ni cyo nacyo mugifate, kuko bahera kuri abandi babahanga. Urumva so uko uzakora cyane, waba sponsor ataba sponsor, ariko wabonye amanota menshi uzabona priorite aho wajya hose, haba muri public no muri prive. Niko bimeze, urumva. So rero mwige cyane kugira niba hari imyanya bashoboye kuba bayibaha, kandi twabwiye yuko cyakenewe. Ntabwo hose aho ikibazo kibaho ni iki, nuko hari abo bohereza kujya gukora ahantu bakanga kujyayo yabivuze ngiri hano kuko ashobora gukorera ahantu henshi.
mwongeye kwirirwa mwananiwe turashoje muhumure. So reka dushimire registrar na bagenzi bacu bavuze ku myuga badusobanuriye imyuga mubaha amashyi. Namwe rero turabashimiye cyane muri abantu beza cyane mwafashe umwanya wanyu mwatwumvise kandi muranashonje ariko mwihanganye kuko tanga ikinyanabi umurwayi uzaba umwishe cyangwa uzaba utumye ababara cyane ariko mwebwe ntabyo muzakora mwebwe muzakora akazi neza muzaba abaganga beza. So turabashimiye dushimiye n'abarimu batwemereye ko tuza hano. Reka tubifurize amasomo meza n'umugoroba mwiza. Reka tuzahurire mu kazi kandi ntimuzakora amakosa. Sawa? Okay.
Turabashimiye cyane mwadukorera akazi ahubwo twe twabye kubishyura kuko byo mwadukorera akazi kacu. Ariko nanone iyo bafite abantu bavuye i Kigali ari ukuntu nyine byongera ingufu. Rero turabashimira kandi tubashimira n'ukuntu imikoranire myiza dufitanye. Nabizi yuko kanso nafatanya ibikorwa byiza bacu baradufasha aho bigoranye bakatubwira ati mugorera gutyo bakutugira inama. Rero turabashimiye cyane kubera umwanya wabo batanze. Ntabwo babyoroshye hari amashuri atandukanye cyako Ines mu mashuri mutangiye gusura bwa mbere. Rero byo turabizirikana ko mudufasha. Noneho kandi namwe turabashimira ko mwitanze muhageze kare ntimwanarambirwa. Twabashimiye nefite impungenge ko wenda muri sohokera ariko ndabashimiye ko mwitanze ntimunasakuze uko sometimes ibyo twababwiye nka indexing please tugiye kubikurikira ku buryo at least mu kwezi kumwe tuba tubirangije. Sibyo ntimunyemereye ndavuga na bayicodi ku buryo babikora bikabirangiza. Rero murakoze cyane maybe tujya kuri management basuhuze. Murakoze.